Well, we're glad to be back. We had a great response to our last video, and we wanted to bring you some more great content and an informational session that I think will help a lot of people out there who are dealing with some of the memory issues when it relates to dementia or Alzheimer's. Again, we're here with Selena Lloyd, Executive Director of Altius Senior Living. How are you, Selena?
I'm doing pretty good. Thanks for having me.
Great. So I mentioned that a lot of families, as their loved ones grow older, begin to exhibit signs of a disease process that we know as dementia or Alzheimer's.
Right.
It's something that affects so many families. Lots of times we don't know exactly how to pinpoint whether it's just a natural sign of aging or if it's a disease process. So can you go over maybe just what we would be looking for when it comes to dementia and Alzheimer's?
Sure. So a lot of people have a misconception of Alzheimer's. They use it as a blanket statement when really dementia is the umbrella that Alzheimer's falls under. And so I brought a little cheat sheet because there are actually 10 diseases that fall under the umbrella of dementia. And so I'm just going to list them off, and I have a cheat sheet here because it's quite lengthy. Alzheimer's disease is one of them. Vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia, Parkinson's disease dementia, which a lot of people don't realize, right. Huntington's disease, Creutzfeldt-Jakob disease, Wernicke-Korsakoff syndrome, and normal pressure hydrocephalus. Those are all under the diseases that are under the dementia umbrella.
Yeah,
Alzheimer's being the most common.
Maybe the most common that we've kind of all heard about.
Correct.
It actually gets a lot of time in the media, and it's just a disease process that a lot of people are familiar with. Mm-hmm. I didn't realize that there were so many under that umbrella. So. Right. That's something to consider, that it's more a collection of diseases under the dementia umbrella.
Right. So 60 to 80%.
Wow.
Of Alzheimer's is 60. It makes up 60 to 80% of the diseases under the dementia umbrella.
Wow.
60 to 80 Alzheimer's.
That's quite a bit.
It is.
That's quite a bit. So let's get into just the practicality of the day-to-day. Sometimes I'm forgetful. Sometimes I misplace my keys, or I don't remember the name of something.
Thankfully, that's not the only indicator.
Right.
We'd all be diagnosed pretty quickly.
Exactly. But talk a little bit about maybe some of those early signs of...
So there are different stages. Dementia has stages. And so it's early, middle, and late stages.
So what are some of the early ones? Like if I'm at home and I'm caretaking for my mother or my father... what should I be looking for?
You'll notice there's several, and everybody's different. Some people have one or two, some people have them all. So, and if somebody exhibits something, obviously without a doctor's diagnosis, you can look for clues, but you do want to go to a professional and get the diagnosis. But if you start noticing that mom or dad is having difficulty with word finding, anything that is a typical task that they would do, but a little bit more complex, if they're having difficulty with those things that they would normally be able to function just fine with, those are some indicators. Losing your train of thought while you're in conversation. Now, like I said, this cannot be the only thing.
Sure.
But
it could possibly be an indicator that possibly something may be beginning to happen.
Right. If you're getting multiple of these, or you're noticing mom and dad, it's happening more often and just increasing in frequency, those are, things that you can start noting, right? You don't really necessarily have to do anything right away, but noting that stuff and paying attention to the progression is important.
That's a good point. It's not necessarily that you have to find some kind of assistance or even put them in an assisted living facility or even a memory care facility, but you want to kind of keep track of that. You want to start kind of putting that down.
Right.
So what are some of the middle stages? You mentioned that. Is it just a progression of some of these earlier things?
It can be, these things start happening more frequently, but there are other things that can start creeping up as well. So if they're confused about their location, where, they they're in their home and they're asking where they are.
Yeah, would seem to be like a more obvious, like, why is this happening?
And a little frightening to the kids.
Absolutely.
You know, I know that in the past, some of my patients have just asked, where are they? And it makes them scared as well. So that's one of the signs. Having any decreased interest in the things that they normally love to do. That's a big indication that
that's
something
an interesting
is going
one.
on.
Yeah,
Right.
that's an interesting
so
one.
I can speak personally because my dad is a writer and loves to write. And we started noticing that he wasn't writing as much anymore. And it was a big indication for me. And we did talk to his doctors about that. And, you know, they put certain medications in place to help him have more interest. But that was a huge indication for us. He's obsessed with writing. So
right. Something he loved to do on the daily, or something that was really important to him, and he lost interest in that.
Right.
So that's a really good one.
Right. One of the other ones is difficulty with sleeping, or, you know, unstable moods, major mood swings. Those can all be kind of signs that there's something going on.
So then as the disease progresses, we go into what's called late stage dementia.
Right.
What are maybe some of the challenges with that?
Right. So difficulty walking, like unable to walk their normal way. You know, they need assistance with walking, which was something typically when I was doing therapy, that was something that I would come in at, and I would help them just walking normal, try and get that function back to normal. Some people don't realize that they are more susceptible to infections, the later stage dementia. And there are many factors for that.
Are you talking about like UTIs or those types of infections, or is it just a general?
It's just general.
Okay.
And UTIs being one of them, but it's just general infections.
We have a great video on that too, on
Right.
UTIs, and we did that because it's really important. So it's kind of all placed together in that role of like being able to assess maybe what's going on with your loved one. So
it boils down to care, how they can care for themselves. And when the dementia progresses, their ability to care for themselves, simple as cleaning cuts or hygiene, showering correctly, toileting, hygiene, those things can creep into infections. So you don't think about that as being a sign or symptom, but it can help doctors to see that the disease is progressing.
Right. So when I initially asked what's the difference, you know, from distinguishing aging and dementia, it seems like there's more of a consistency of symptoms, maybe more of a frequency of symptoms.
Right.
And maybe a change in their standard behavior that is quite different than just, you know, like you mentioned mood swings or behavioral changes. Those can be big indicators for that.
So I think most people are afraid of dementia. And so when we have little things happen, like, misplacing your keys or forgetting what you had for breakfast, you know, people get very scared right away. And we definitely have normal aging forgetfulness, difficulty word finding. Those things are all normal until it becomes consistent. If you misplace your keys and your normal process of retracing your steps isn't getting you back to your keys, you kind of...
That might be okay. That might be an everyday occurrence,
right,
or,
but if you're
just
not
an ordinary
able to get
occurrence.
back to it,
Right.
In the typical aging process, you're able to just walk back and figure out where your stuff is. If you're unable to do it, and it happens more frequently, those are signs. It's normal to be frustrated when you're forgetful.
Sure.
Those are normal things. There's a definite natural process, but I think as families, we can help encourage our loved ones, because I saw it all the time when I was doing therapy. My patients were scared of, if they forgot something, they were like, does this mean I have dementia?
Oh, yeah.
And I would always tell them, don't worry about it. It's normal to age. It's normal for our brain
Sure.
to not function as well as it did in our 20s and 30s. And when it's a problem, family will help, and the doctors will be able to diagnose at that time, and then the process can start. But worrying about it isn't really going to help. It's natural.
Those are all great points, because I think what you do see is exactly that, a certain amount of fear that starts to happen. And at times, even the family has difficulty navigating that, because, it's hard to differentiate sometimes.
Right,
So
right.
I feel like that helps us clear that up a little bit.
Well, I think frequency is like a big thing. If mom, forgets the keys, no big deal. But if every day she's forgetting or not placing them in the same spot she used to always place them, those kinds of things are concerning. And I think a lot of times the mom or dad will start to notice, I'm not able to keep track of these certain things.
Right.
And they will, I'd say women more often are willing to admit that stuff. I typically, and of course this is typical, this is not across the board, men seem more often to mask the,
I would probably be guilty of that myself.
Well, yeah, and we're talking about the generation of
sure,
baby
absolutely.
boomers. They're
you want to be self-sufficient, and that's a huge thing for anybody.
Right.
But I think especially for men, I think
men of that generation.
you really have to keep a closer eye on that and kind of draw that out in them to see what's really kind of going on.
Right.
So those are all really great points.
If your family is if your mom or dad is starting to forget family members' names, or really like long-term information that they've known for a long, long time, and they're not able to remember those things, that's more of a sign of we might need to go to the doctor.
Okay.
If they're asking for that same information over and over and over, those are kinds of signs. The typical, not very frequent stuff we all do, not so much.
Might just keep an eye on that, but not necessarily anything really to be concerned about.
Anything that they used to do regularly, that they could do regularly, that is, eating, bathing, just walking, the regular stuff that we do, typical day-to-day stuff. If they're not able to remember how to do those things, or you're seeing an increase in frequency with that, those are the differentiating factors between aging and possibly dementia.
Well, great. Those were great points. And I think, that's why we do these videos, because you know what? Sometimes, it's the nuances. It's, it's that little difference, but it could be an indicator of something that's to come or something that's starting to progress.
So a quick little side note, I guess. Most moms and dads are living at home or in an apartment alone, and they can keep that stuff to themselves. You don't know if they're not living with you or they're not in a care home. You don't know that they're misplacing their stuff, or they're having difficulty with their, putting on their shirts or that kind of stuff. So in those situations, having them where people are able to pay attention to them, like residential care homes, then people can start noticing. Caregivers, care partners can start noticing that.
Well, that's a good point. And that kind of, really is something else I wanted to talk about, because I feel like caring for someone with dementia, once we know that this has been diagnosed, we know that it's a disease process that has started in mom and dad. Talk about the challenges of that.
Okay, so let's say that you find out that mom and dad do have dementia. And so, you're in a position where you can bring them into your home. One of the main things you want is routine, and a stable routine.
So establishing a stable, like a daily routine, like of activities, or just having a structure.
If you consider like eating and everything, activities, just a routine. Breakfast at a really similar time, getting up out of bed at a similar time, going to bed, just the daily stuff. Including fun times and entertainment times. If you can make those pretty routine where mom and dad know what to expect, that's going to be really helpful. When they have major changes, that really sets off dementia, and not necessarily like going to stay that way forever, but you will notice a major change in mom or dad's behavior if they have a major change happening and they have dementia. So we like to, that's one of the main things that we can provide in our residential care home at Altius is the ability to have that routine, to have that scheduled, and it doesn't have to be super strict, because I'm a big proponent of, as you age, you should be able to, determine what your life wants to be like, right? You're retired. It should be not super structured, but there needs to be stability. There needs to be routine. And in a home, you know that you can provide that. The caregivers and the care partners will know mom or dad, and they'll get to know their routine. There's a huge benefit to that. And I also encourage the family members not to wait until dementia is really bad, because that move out of whatever their living circumstances are at the time, that move is going to be difficult for them. So the earlier into dementia they are, the easier that transition is going to be.
So that's interesting. That's a good point. And maybe something that you don't often think about at the beginning. But so what you're saying, to reiterate, is if those symptoms are starting to progress, there's a time where you want to move them into that environment that's going to care for them on a long-term basis. Mm-hmm. So it creates that stability. It creates the care pattern for them before it gets to maybe a late stage where in that move, that would create more of a stress for them.
Right. Are you familiar with the term age in place?
Yes.
Okay. So that's really what that's about. We're creating an environment that when it starts to become something that's they're unable or unsafe on their own, moving them into some type of care, residential care, is a really big benefit at that time, rather than waiting until they're, really far progressed and you absolutely need the help, because then it's so hard for mom and dad to adjust. And I know cost is always a factor, but the outcome and the what mom and dad go through, I don't know the term for it, but their experience of that move is going to be made easier if you do not wait until the very last.
Yeah, and that does make sense. Mm-hmm. It does make sense. So I know that at Altius, we have a program called Elevate, which was really, when I first heard about this, I didn't quite understand exactly what it detailed. But since learning about it, Elevate is wonderful. It's where we are taking technology or anything out there that has been shown to help cognitive function, improve stimulation. Talk a little bit about that. Like, right. How does that work for your residents?
We know that cognitive stimulation is really important, regardless of age or disease, but especially with dementia. And this program allows us to have different avenues, technology being one of them, to help stimulate their brain, stimulate communication. So the different games and different apps, and sometimes just teaching them how to use the tablets or iPads, letting them use those to communicate with families, having the FaceTime or, whatever systems being used. All of those things stimulate. And I can tell you firsthand, from being in their homes when they're usually alone, the idea of using technology is daunting and frustrating, more frustrating than it's worth when they're alone. And they would not even attempt most of the time. And I was also like their, godsend in so many ways, because I could just fix their phone, get it off a vibrator, something silly like that.
We can all use that help sometimes, for sure.
Exactly. So having them just use technology in that way is stimulating. Yeah. And then also simple things just like, word games or physical puzzles. All those activities are really helpful in that.
That's a great program. I know that for some Parkinson's patients, vocalizing becomes an issue. So being able to use technology to help them with that, to really further and strengthen their voice and, those muscles associated with it, can really help keep them vocal much longer.
Right.
So that's an amazing thing.
Right. Well, it not only helps keep them vocal, but when they are vocal and when they feel like people can hear them, they're more apt to speak. And when they're more apt to speak, they're more apt to communicate with people and have socialization. Right. If they start getting scared because they try to talk and people can't hear, or they stutter, or that kind of stuff, it really progresses the disease process much faster. So
great point.
Knowing those things really helps.
So one last point I wanted to bring out is, I know that working in my job in emergency services, I have a short window where I deal with patients with dementia or Alzheimer's. Now, that requires a different level of patience at times. It requires a different level of empathy. How do you manage that with your care partners at Altius?
Right. Well, that's pretty important for us because we know that we're going to be dealing with, lots of different people. It's a big spectrum, right? So, and although we don't accept we don't accept residents into our home who are exhibiting aggressive behavior. It might, there might come a time where they get a UTI, and that is one of the things where they become aggressive. So training and protocols is pretty important, and we are consistently training our caregivers on how to manage. And it's simple as, redirecting the resident and seeing how to manage.
Or a de-escalation in their symptoms and how to manage and take care of that.
Exactly. So we're consistently training our caregivers so that they can manage those.
That's great. So for all the families out there, what would you say is the time for support? When should they reach out? When should be that point where, hey, you know what? I've seen some of these symptoms. We've had a few indications. What are the indications for memory care at that point?
So obviously you want to consult a professional, right? And you need to make sure that you have the diagnosis, that a doctor is the one who's told you, hey, this is what's going on. But also you want them to give you the specifics about the disease and the specifics about their exact disease process. Once they start entering middle to late stages of dementia, then it's time to start considering what kind of care they can receive. And there's a big spectrum of care. There are daycare centers where you can go and leave mom or dad for a few hours, once or twice a week, just to give you as the caregiver a break. Their caregivers can come to your home for a little bit. And, all the way from residential care homes, assisted living buildings, and nursing facilities. So once they are kind of not able to care for themselves and you're not able to do it for them, or it's becoming an immediate inability to do the necessary care for themselves. Because
those activities of daily living that we talk about.
And showering, bathing, eating. You don't always know whether they're eating or not. And you can't tell until they start really losing weight. And unless you're actually putting them on the scale, which most family members are not, it's hard to tell that somebody's losing weight until they've lost a significant amount of weight. Nutrition is extremely important as they age. And, we are consistently fighting the aging process of our body. Muscle atrophies much quicker as we age. And if you're not actively fighting against it, then it's just happening. So nutrition is a big part of that. If they're not eating and they're not doing that stuff, then
that's a great point. Yeah, something to look out for on that.
And then I think the most obvious one is if mom or dad starts wandering, trying to escape.
Yeah, that's what most people think about when they think of an Alzheimer's patient or a dementia patient, is that they have the inability of remaining in their space and feeling safe. So they go out and they try to wander. They try to,
Right.
They're not really sure what they're doing in that situation. That can be a very dangerous situation. Yeah.
Extremely dangerous. Yeah. So those are the times that you want to start looking into more care.
Well, Selena, again, this has been a great series. I feel like people are getting a lot of value from just understanding, even on a small scale, just some of the disease processes, some of the things that are challenges to family members in dealing and caring for their loved ones as they age. So I want to thank you again for giving us all this great information. We'll definitely find some more topics to talk about, and hopefully we can do this again soon.